Hi there, this is Dr. Kukreja A. Kalani. I'm a practicing homeopath and I've been practicing since last 25 years at Powai, that's in Mumbai. And today I'll be talking about piles or what we call as hemorrhoids. So, what are the types of hemorrhoids, their symptoms, and how do you diagnose piles, and what are the treatment options available in homeopathy, how well it works with these cases. So, we'll discuss this in detail. So, let's begin. Piles is something most people don't like to talk about because they suffer in silence, because they don't like to express this to their relatives or to the doctor. Also they have some inhibition, but this is like, you can't ignore. So over a period of time the pain is so immense, it's better to be treated as earlier as possible, because if untreated it can lead to recurring problems and eventually a surgical intervention. Piles is also called as hemorrhoids. So they are basically swollen blood vessels located around the rectum or in the anus. These vascular structures can cause discomfort, bleeding, and other symptoms. So what are the symptoms of piles? The first symptom is bleeding. So one of the most common symptom is bleeding. So this can occur when the swollen blood vessel rupture happens and the toilet, say the bowl or the toilet paper gets stained. Second is itching or irritation. Piles can cause a lot of itching, irritation in the anal region due to the presence of swollen blood vessels. Next is pain and discomfort during passing motions, and especially while the bowel movement. So the external piles can cause pain if they develop a blood clot, that is called as thrombosis. Next is swelling or lump. Piles can lead to the formation of a lump or swelling around the anus, which can be felt externally. Next is protrusion. Internal piles may protrude through the anus during the straining or bowel movements. And next is mucus discharge. Some individuals may experience a discharge of mucus from the anus, which is associated with internal piles. Next is the incomplete bowel movement. The presence of piles can contribute to a feeling of incomplete sensation, as if they have not passed the motions fully. So, what are the causes of piles? First is straining during the bowel movements. Second is chronic constipation or diarrhea. Third is pregnancy. So, here are some factors that contribute to piles during pregnancy. Increased pressure, that's because of the growing uterus size on the pelvic veins and the inferior vena cava, leading to congestion in the pelvic area. So this contributes to the development of piles. Second is hormonal changes during pregnancy can weaken the walls of blood vessel, making it susceptible to swelling and therefore enlargement. Next is constipation during pregnancy because of the hormonal changes and the pressure from the growing uterus on the intestines. Straining becomes a common symptom, and this can worsen the existing piles or contribute to their development. Next is genetics. Some women may be genetically predisposed to developing piles, and pregnancy can increase this susceptibility. So what are the things you should you should follow so as to prevent the worsening of the symptoms? First is the dietary changes. Eat a high fiber diet rich in fruits and vegetables, whole grains and legumes to soften the stool. Second is regular exercise. Engage in regular physical activity, walking and prenatal yoga so as to promote good digestion and bowel movements. Good toilet habits, that is avoid straining during the bowel movements. So and second is warm baths. So soaking in a warm bath 10 to 15 minutes several times in a day can help soothe and discomfort the associated piles. And last is consultation with the healthcare professional in case the problem persists or the bleeding is too much and the pain still goes on. So overall, managing piles during pregnancy involves adopting a lifestyle modification, self-care measures, and seeking medical guidance. Now the next factor leading to piles is obesity. Being overweight can increase the pressure on the rectum, which contributes to the development of piles. Next is aging. Aging is associated with the weakening of the connective tissue that supports the blood vessels in the anal area. Next is genetic factors. Some individuals may be predisposed to piles due to genetic factors. Sitting or standing for prolonged periods. So prolonged sitting or standing can contribute to the development of piles by increasing the pressure on the rectal veins. Next is the low fiber diet. Diets low in fiber can lead to constipation, which is a common factor for development of piles. Avoid heavy lifting. Straining during heavy lifting can increase the pressure on the rectum. And then what are the types of piles? So we have to distinguish what is the internal pile, external pile, prolapse pile, thrombosed pile. So let's start with the internal piles. These are the piles that form inside the rectum where there are fewer pain sensing nerves, so they are less likely to be painful. However, they can bleed, they can be prolapse, and they can extend outside the anal opening, which can cause discomfort. External piles, they form under the skin around outside the anal opening, and that can be very itchy and painful, especially when sitting. Now, what is a prolapse pile? Piles that extend out of the anal opening during straining or bowel movements, and these are referred to as prolapse piles. Next is the thrombosed pile, when the blood pools in the external pile and it can form a clot. So this is called as a thrombosed pile. This can cause significant pain and swelling. Now let's see how's the grading. What is grade 1, 2, 3, of piles, and 4. So grade 1 is when the small inflammation, usually inside the lining of the anus. This may bleed but will not protrude. Second, larger swellings that may come out of the anus when you go to the toilet, but then they return on their own. So they go back to their position. And grade 3, piles that hang out of the anus and mechanically you have to push them back whenever you go to the toilet. Next is grade 4, piles that always hang down from within the anus and cannot be pushed back. So this may contain blood clots or pull much of the lining of the rectum through the anus. Risk factors: as you age, your risk of developing hemorrhoids increases. That's because the tissue and support the veins in your rectum and anus weaken with age, and they stretch like what happens during pregnancy. The baby's weight put pressure on the anal region. So what are the complications of hemorrhoids? First is anemia, that is low hemoglobin. Next is strangulated hemorrhoid. So if blood supply to the internal hemorrhoid is cut off, the hemorrhoid may be strangulated, which can cause immense pain. Blood clot formation, which is like a thrombosed pile. This condition also can be very painful and sometimes needs to be drained. So the best prevention is basically to keep your stools soft so they pass easily. Eat high fiber diet and eat more fruits, vegetables. This increases the bulk of motions. Exercise is very important. Stay active, that can prevent constipation. Exercise also helps reducing weight and pressure on the veins. Do not strain very hard for stool. Straining while passing stool creates more pressure over the veins and the bleeding happens. Drink lot of fluids to keep the stool soft. And as soon as you get the urge to pass stools, you should attend to that urge. Do not ignore. Avoid long hours of sitting. Sitting too long can increase the pressure on the veins of the anus. Now let's talk about the role of homeopathy in treating piles. Homeopathy can be very useful in treating of piles. It is useful in stopping the bleeding in piles. It can cure the venous congestion and bleeding. It can also be taken when the patient develops a feeling of soreness. So it relieves the soreness, pain, helps in constipation, and also the varicose veins are better. It can stop the bleeding, the soreness sensation, the pain, burning which lasts for a few hours after passing motion, the pricking type of pain. All these symptoms can be well managed with homeopathy. So faster you treat, the better is the prognosis. So if the grade 4 and 3 piles do not respond that good to homeopathy, but in the first, second, and if the stage 3 has just begun, we can have a complete reversal, and we can minimize the tendency to piles, and further you can prevent any fissure or fistula problem as well. And the most important thing is the tendency to suppuration. Because of all that, the area can get infected. So we can give medicines to disinfect and heal. So this is a process we adopt, and as we get to it through the cyclic mode, we can completely heal the passage. So it gives relief from the pain, it also gives relief from constipation, and very important, the it also covers the digestive disorders, like if you have acidity, if you have too much of gas problem, or the discharges are very acrid, or you are having constipation or diarrhea, which causes stress over the anal region, causes stretching. So all the digestive disorders also can be managed well with homeopathy. So I believe I have just helped you out understand piles. So what are the symptoms, the grades, the types, and essentially how homeopathy can be very helpful in treatment of piles, so as to avoid the deterioration of the problem and to prevent any surgical intervention. This is Dr. Kukreja Kalani signing off. Thanks.